Greetings, friends and followers. This is Nurses Talking. I am Del Barzy. As always, if you like what you see and hear, subscribe, leave us a comment. Today, my guest is Dr. Nichelle Henry. And Dr. Nichelle Henry is the CEO of the Nurse Retreat, a sisterhood created to combat nurse burnout and increase self-care for African American female nurses. After being a nurse manager, witnessing the severity of nurse burnout amongst her team and the lack of resources, Dr. Nichelle Henry decided to create a safe place for nurses to share their truth. She is also a survivor of nurse burnout, experiencing the negative impact firsthand. She is the author of her story, From Teen Mom to Earning a Doctorate's Degree. Dr. Nichelle Henry is passionate about seeing all win from within. So, welcome, Dr. Henry.
Thank you for having me. Thank you.
Thank you so much for joining me this morning. I really do appreciate your time talking to us today. So, I always want to start with, I always want to know why. So why are people nurses? Why are you a nurse? What brought you to that?
So that is a great question. When I was growing up, I don't have the story of always wanting to be a nurse. I actually wanted to be a lawyer.
Okay.
I love debating. I love all those things. But actually, my misery at the time was being a teen mom. And I was delivering my daughter. And during the time of me delivering my daughter at 17 years old, I witnessed my nurse, my labor and delivery nurse, go to bat for me with the doctor. I had a complication with my daughter that required an immediate C-section, and the doctor wanted to wait a little bit. And my nurse fought for me. She advocated for me and told the doctor, we have to do this now. If we don't take this baby, we're going to lose her and her child. And the way I witnessed her advocate for me, I knew in that moment that's what I wanted to do with the rest of my life.
You just gave me goose pimples. Oh my goodness. Oh my
yes,
goodness.
ma'am.
You just gave me goose pimples. Well, thank you for that. Oh,
absolutely.
So
absolutely.
In what areas of, so what challenges did you face anyway, becoming a nurse? I mean, you're telling me you're a teen mom, so.
Oh my goodness. So first of all challenges. I went to school in Jacksonville, Florida. So up until I went to college, I never experienced racism on the level that I experienced in school. I went to a university that was a private university, and there was maybe in my class of 25, two African-American nurses. So just that journey in itself, hearing the quotes, maybe this is not for you, you need to reconsider your career. We hear that so often, and not having that support that I thought that I would have with paying so much money for college, just feeling isolated and alone and really having to put my 100% into my academics without the support of teachers. I experienced that. It was just a real difficult road for me, but it also taught me to stay in the grit and the grind, and knowing that when I got to the other side, it would be meaningful for me personally, and not about a check and not about a financial status, but really about becoming something for my child at the time. So my experience was not, I experienced nurse bullying once I became a nurse. Nursing school in itself was difficult, but once I became a nurse, I experienced nurse bullying, I experienced racism again, and then also burnout for sure.
So in what areas have you worked?
I started my career in 2012. Actually, I was everything. I was a sitter, I was a monitor tech, I was a nursing assistant. So that background in itself helped me to understand even more nurses and being able to come from that perspective of being on the side of the assistant. And now the nurse, it gave me great appreciation for the assistants as well as myself as a nurse, because they are nurses without a title. Like they know everything about your patient. So with that experience in 2012, I started off in the med surg unit I think it's called Ascension Health, one of the Ascension Health here in Jacksonville, Florida.
Mm.
I started off on the med surg floor there, and then I went over to Trauma One Hospital as on a step down unit for trauma patients. And then after that, I went into performance improvement for 6 months because it was not for me. And then I went into leadership, and I have been in leadership ever since then. And I just took a new position. I relocated my family to Atlanta, Georgia. And because I'm really focused on the nurse retreat and getting that entrepreneur status, I took a CBICU assignment here in Atlanta.
Well, congratulations on that. I wish you much success.
Thank you. Thank you.
So, what made you create the nurse retreat?
That is a great question. That was not my intent originally. In 2015, I experienced nurse burnout and did not know I was burnt out. I was going through a nasty divorce with my then ex-husband, well, my husband, then ex-husband. And I thought when I was coming to work, I was turning off my personal life. I thought when I came to work, I'm able to handle my patients. I'm able to do all that. Then when I get home, I'll deal with home life. But I didn't know that home life and nurse life had intertwined, and I became a different person on the unit. And I had trusted friends and colleagues that would say, you know, Nichelle, something is off. I'm not sure what it is. You sure everything okay? And what we do, oh yeah, I'm fine. I got this. Very defensive. And I did not come to myself until I signed my name at the end of my divorce paper. And it was like a weight was lifted off my shoulders. My eyes was open, and I had transformed into an ugly, ugly person that I did not know. And so I looked for a community that looked like me, that can answer my questions, that can deal with my pain, that can talk about my triggers and my sorrows, and even just dealing with life as a young African-American young lady. And I did not find that community. So I said, you know, okay, maybe this needs to be created, but I still put it on the back burner. And then once I became a nurse manager, so many of my nurses and my team members came to me, of course, dealing with personal life, trying to handle professional life. And I knew in that moment that the nurse retreat needed to be birthed.
So you touched on a question that I wanted to ask, actually, because I really wanted to know, what are the signs that we ignore?
Right.
Really?
That is such a great thing, great question. So, you know, the normal signs, you know, the staffing, with the staffing issues, we talk about management being disconnected. We talk about those things. But what I do with the nurse retreat community is I dig deeper in that. To me, I try to put it as a tree. So the top of the tree is what we normally look at, and that's the obvious things. We're short staffed. You know, we have the management that's disconnected. That's the top of the tree. The root of the issue, or the root of the tree, is, you know, emotional exhaustion. We know the definition: emotional exhaustion. We disconnected as a person, and then also dealing with our own issues. But the root of burnout starts from within. Because the same issues that you're dealing with staffing issues, the same issues you're dealing with management, the same issues you're dealing with the patient acuity, there's another nurse on your unit who is not burned out. So we're all dealing with the same thing. How is it that this nurse is burned out and I'm not burned out? And the reason why is because the root of the issues are, you know, our personal life, how we handle emotional triggers, how we handle our mental status, how we handle crucial conversations, how do we handle when a physician talks to us inappropriately and we're not taught how to reserve our feelings in that moment to take care of that patient and then readdress them professionally. We're not taught those soft skills as nurses, because it's almost like, I want to be a nurse, I want to be a nurse, I want to be a nurse. But then when you become a nurse, those textbook issues is fine. We can deal with the diagnosis. It's the soft skills of emotional intelligence and things like that we don't learn.
Yes. That is really awesome, because that's how come, you know, so many of us just fall apart.
Right.
You know, we don't see, you know, those signs, or we don't acknowledge those things along the way. Yeah. So listen, so I see that you're targeting a very specific group. You're targeting African American females.
Mhm.
And we know that nursing is wide, it's all sorts of demographics. So why
Right.
African American females?
So that is a great question. When I started doing research and market analysis for this particular business and entrepreneurship, I saw a lot of communities that offered, different demographics and served those different graphics. But when it came to us talking about racism and us talking about, how we show up as African American nurses in a healthcare field that's not always welcoming for us, or it may be welcoming for us, but within ourselves, we haven't established that confidence in ourselves as sister nurses to say, I'm showing up, I'm going to be professional, I'm excellent, and I'm here and I belong here. I did not find that community. So when I looked into that research, it's so broad. Nursing is so broad. There's so many different avenues. But what I saw with my research and with my, as a manager in leadership, most of the times it was African American nurses, females in particular, who did not know how to navigate the real world of nursing, who did not understand how it's okay to have those soft skills revealed because the trust is not there. So if I can create a community where it's trust and it's built on sisterhood, and not only that, don't share your story, sis. I share my story, and it gives you that breathing and that time to just exhale. That's what my goal was. So that's the reason why that particular group.
I see. Okay, and so is this a virtual group? Is this a brick and mortar thing?
So great question. So I'm in the process of defining everything. So it's actually a blog. My blog is thenurseretreat.com. And what happened is the blog comes to life and I have nurse retreat events. So my first event will be here in Atlanta, and it will be on November 6th. And it's where we come and we do team building. We do communicating skills. We do anything that's going on in the group. I take a survey to see what areas they need help with, and then I build a retreat around those particular areas.
Okay, that's awesome. I'm going to let me take one quick minute to write on nurseretreat.com. All right, because we
Yes,
talked about this. All right, so what is your vision then for this nurse retreat? How big do you want to see it get?
To be honest, my number one goal was to see one nurse saved, to see one nurse, understand that she is empowered, she's important, and that she belongs in healthcare. And so far, I have met that goal. So wherever God takes me, I'm willing to go. But I do see it becoming a sisterhood, and we having many retreats to definitely get rid of nurse burnout for sure.
Yeah, as you're talking, it occurs to me that one of the things that may appear to be very simple, but we encounter it every single day, that contributes, to me anyway, to our feeling, I don't know if inadequate maybe, but brings up feeling of resentment, is one of the things we encounter is that people tend to just overlook us and assume we belong at a certain level. They look at you, the manager, and ask you, could I speak to the manager? Matthew, my tag just said that I'm the manager.
Right.
But they didn't want to see your face.
Right.
And I feel like that contributes a lot to our dis-ease and discomfort in the role and our burnout. So I'm so happy that
that is so true. And then you asked the question about female nurses. If you look into, we deal with this a lot, but a male nurse, first of all, they have this ability not to let stuff stick to them. You know how females, we are caring, we're nurturing, we're loving. We want to have that, feeling moment. But with males, they're more, males, they have that alpha male ego. And then also they normally don't let things stick to them. But also in a healthcare setting, physicians and different people will be more responsive and respectful to the male, but African-American nurse than the female African-American nurse. So that's the reason why even particular that group, because we have things, we have triggers. We're not blind, we're not slow. We see what's going on. And it's almost like, I don't want to be sensitive to everything, but everything is sensitive to me. So who do I talk to about that?
Yeah. It's almost like you have a full body burn and touching your burning flesh.
You know it. Yes, we've all experienced it.
Yeah. All right. So you talk about teaching people self-care. What does self-care mean to you? Because to me, I realize that it means a lot of different things to a lot of different people. So what does it mean to you?
To me, self-care just absolutely means self-awareness, being aware of yourself. What works for me may not work for you, but self-care is taking care of yourself, meaning your mental, your emotional, your physical, your financial, your spiritual, everything about you. So it's not just I'm going to the spa, I'm going to get my nails done. It's really being aware of who you are and taking care of those inside thoughts, those inside, feelings that you can't share or you don't trust enough to share with someone else. So it doesn't necessarily have to be an activity. It can be a journaling exercise where you're really getting into your mental space. It can be whatever it is for you, but as long as you're touching on the self-awareness of who you are, that's self-care to me.
Yeah. Whatever nourishes you the most, right?
That's it. Mm-hmm.
Yeah, whatever nourishes you the most. Yeah.
Absolutely.
I spoke to someone the other day who included work in her self-care. And I have to admit that I actually hadn't thought of it that way. But she said, if work is what I need to do right now, there's no point in me doing my nails if I'm thinking, oh, I should be at work. I should be doing this. I should be finishing my blog. I should be finishing this, So
Absolutely.
I kind of got that. So what is your vision? What is your big vision for nurses and nursing in general?
My biggest vision for nurses is for us to fall in love with nursing again. Like, I just want that feeling, when you were so excited, you got your acceptance letter into school and you were so excited, you went and got your planners and your highlighters and that feeling that you had, well, I'm really finna take over the world. And then we get in school and it's the grind and the grind and the grind and the blood, sweat, and tears, literally. And then you graduate and those pictures, the first picture you took when you were getting ready to graduate, that school picture, and I look at it and I ask myself, would that nurse be proud of me today? If I look at her, am I fulfilling the reason why I went to school? Am I fulfilling that feeling I had with being accepted into school? And if I'm not, what disconnected me from that feeling? And that's what I want nurses to get back to, the love of nursing, the love of healthcare, as chaotic as it can be, as traumatizing with the pandemic as it can be. We still have to find that love for nursing that makes us want to do this and also recruit other nurses to do it as well.
Yeah. I'm glad that you mentioned, trauma as part of it, because, a lot of us, a lot of nurses, a lot of healthcare workers are just traumatized by the whole thing with this pandemic. And as I speak to people, it's almost like we're flying off, I think way back when, I don't even remember, somewhere in my early teenage years when I first heard the expression, stop the world, I want to get off.
Yeah.
And it kind of feels like that to me as I speak to people, right. And I just want to slow down and stop all this.
Absolutely.
Stop all of this. Oh my goodness gracious. But it really is getting to us, I think.
Right. It is.
Yeah, it's getting to us. Us. So speaking of the pandemic, how has it affected your practice?
To be honest, I wasn't, indirectly I was affected. And what I mean by that is, as a nurse manager, I wasn't at the bedside dealing with the day-to-day of the pandemic in especially in 2020. I was more still feeling the effects because I'm looking at my team. They're so burnt out. They're so tired. And I was a manager and leader over a float team. So they were actually, dispatched to different areas of the hospital. And sometimes the worst places because they needed the extra help. And I felt helpless at the time to be able to refuel them in a season where refueling was out of the door. That was out of the question.
Yeah.
So that was my experience in 2020, really making sure that I'm touching bases with them, encouraging, making sure that I can do everything that I can to uplift them in that standpoint. And now in 2021, when I'm at the bedside, I have to keep my mind focused on my why. I'm in the ICU unit, and even though it's cardiovascular, of course, we're still seeing COVID patients, and on the verge of if we shut down surgeries or not. So it's still a real pandemic. And in my mind, I have to make sure that I'm staying focused on the reason why I'm doing this is to keep my foot at bedside and to make sure that I'm being realistic and I'm being relatable with my content, but also that I'm being a human and understanding that when I get home, I need to decompress and have those moments where I don't pick up extra shifts. I love my team, but I have to disconnect work life from home life. So as I'm going through my journey as a nurse still, I'm also able to relate to other nurses who feel the same way.
Yeah. That's awesome. And I think you just mentioned something that's become really important. Now we're at the stage, I feel, I'm not really, in the trenches anymore, but I feel like we're now at the stage where we can actually still have a disconnect between work life and home life. Earlier on in the pandemic, I didn't see that as possible because people were going home, staying away from their families, and all of that kind of thing, which actually meant that you were bringing the work thing home with you, whether, so not just the very distant, fact that you weren't closely interacting with the people you love and the people who nurture you. So maybe we're making just a little bit of progress, I hope.
Yeah, me too. It's such a challenge. And even now to this day, we're still uncertain. Like, we all took the vaccination and we're in the line of we need to be vaccinated or don't, but it's still the whole thing of we're not sure. We're not 100% sure of what COVID-19, all of it is. And then also the effects it will have in the long run. So it's definitely, when you're in the trenches, like nursing school, you can see the end of the tunnel. I know I have 2 years and I'm out of this and I'm getting ready to graduate. Or if you're on a unit and you don't like the way the unit is going, you can say, okay, in a year after my experience, I'm going to transfer. But there's no end to this. We don't have a tunnel vision to say in 6 months this will be over. I think that is also everlasting as well.
Yeah. And it wears you down. It wears you down.
Yeah. Absolutely.
So, while we're talking about nurses, I've been thinking recently, what is the one, if you had to describe one essential quality of a nurse in one word, what would it be?
One word. I would say resiliency.
Resilience. Okay.
Resilience.
Yeah. Okay.
I would say resilience in every aspect of nursing is resiliency. Yeah.
Okay. I've started looking for those words because I'm wondering, as I speak to people and I realize that we come to this profession from all kinds of different places and with all kinds of different expectations and experiences and what is the thing that keeps us in this with all the different places that we come from. So, okay. Resilience. It's a good one.
Yeah.
It's a good one. Yeah. I have to, all these words make me think about it.
Yeah.
So what advice do you think you give to someone who wants to be a nurse?
My advice to someone who wants to be a nurse would be to do your research and to make sure that you truly understand that nursing is more than, what we believe nursing are when we first start school. But if anyone else can be a nurse, so can you.
Okay. Yeah. My grandmother used to put it this way. She used to say, what man has done, man may do.
Yeah, that's it. And I love it. It's so simple. I love that even better. Yes. Absolutely.
Yeah. So you can do it. You can do it.
Yeah.
Yeah.
You can do it.
But, I think that also we need to communicate to people that it's not Grey's Anatomy, as a friend of mine said. It's not Grey's Anatomy.
It's not. And then, it's so beautiful though. I would say that. Like I love it. When I look back on my nursing career and I look back on my journey, it's so beautiful. It not only taught me professionally, but I learned so much personally. I learned so much about myself and, dealing with life, and it opened up my eyes when you're at the bedside of someone who's transitioning to the next world and being able to see that process. It brings a perspective on life like no other. Yeah. So even with that being said, it's so beautiful. It's so worth it. And I would do it all over again if I had to. Yeah,
I absolutely agree. And as you mentioned, being at with someone who is transitioning.
Yeah.
For me, that's one of the greatest honors, I think.
Yeah. Yeah.
You know, I never thought about it that way before I became a nurse.
Right.
That it would be an honor to be to stand with someone, to hold someone as they die.
Right.
But yeah.
Yeah, that's one of the most pivotal moments in my nursing career. And I was a tech. It was so like just life-changing for me. And what I realized in that moment is that when I was at the bedside of this gentleman, he didn't ask for his plaques. He didn't say, bring me all my degrees I got in life. He didn't say, you know, pull up my bank statement and let me look at my last statement in my bank and what I got in my bank account, bring me my keys to my car. He didn't do any of those things. He asked for his family and for someone to be at bedside with him. And that just put it in perspective that relationships and, you know, family and friends are so important, and it's worth more than gold.
It is. It absolutely, it absolutely positively is worth more than gold. And you mentioned all the things that you learned as along the way as a nurse, because I think that when we enter nursing school, we're not actually expecting to learn so much about ourselves.
Right.
And it kind of strips us down to nakedness.
It does. It shows us who we really are. You're absolutely right.
Yeah. It's one of those things that it's almost like a boot camp. It breaks you down and then it turns around and builds you up.
It does. That is a great perspective. It's the truth. It's the truth. That's true.
So, yeah, honestly. All right. So you know, as far as I have a feeling in my view that healthcare and healthcare policies and healthcare delivery and all of that will not be complete or satisfactory or to either the deliverer or the consumer until we get nurses more involved. What do you think?
That is a great perspective. I honestly believe that we are the heart of healthcare. And that's my thoughts on that we are the heart of healthcare. And that is a great perspective to have. And we are so important. And we're the heart of healthcare, and no one can survive without their heart.
Right. So we need to be sitting at the policy table. We need to be.
Yes.
Yeah, and I really, one of the things that I want to do with this, one of my goals with this is I really want people, nurses and non-nurses alike, to see just how much we bring to the table. I was speaking to someone the other day who put it very well. She says, you need to know, you know, the powers that be can be, you need to know what you have and what the people that you have bring to the table. So I really want it to see how much we actually do bring on all levels. To the table and how, you know, much we can contribute.
Right.
Yeah. So now that we are here, one of my nurses said to me the other day that nursing for her, and this is someone who, in general conversation, who's been a nurse for like at least 40 years, and she says she's come to the realization that nursing is not supposed to be a lifetime commitment. It's supposed to be something that you learn, you do, you teach, you move on. I have a different perspective. What is yours?
My perspective is this is what I tell every nursing student, everyone that's interested in nursing before they get in nursing, that nursing starts in the heart. You're a nurse before a paper. So I don't think it's a cutoff. To me personally, I know I was a nurse way before I became a nurse. It's in us. It's women, you know, nurturing and caring and wanting to see things better and doing interventions and wanting to see the change of it. That was in me way before I went to nursing school. I just didn't know it. And so in nursing school, you know, of course, you're becoming a nurse, and then after nursing school, when you are a nurse, it never leaves you. Even when you're transitioning to different perspectives as a nurse manager, instead of me caring for my patients or bedside as much, I now had my staff. That was my heart, was my patients, and I had to care for them like I would do my patients at bedside. Now that I'm transitioning to entrepreneurship, my bigger goal is to care for my nursing sisters that are still in the trenches and teaching them how to evolve. So even though my title may change and my perspective in life may change, nursing never leaves me.
So you've actually just expressed very well my perspective, because I believe that nursing has nothing to do with, it's not a profession or a career or a job. It's just a state of mind. So that's my definition of what it is to be a nurse. It's a state of mind.
And what I also say is it's a calling.
Yeah.
It's a calling for all of us. And no matter how much we may try to, I hate it, I don't want to do it anymore. It's within our heart. It's our calling. It's the assignment that was given to us from birth, and we can't just walk away from it.
Yeah. Yeah. And we go through that. We grow through this thing.
Yes. Yes.
I think back to my own days as a student, you know, and I went to nursing school far away from home. I'm a Caribbean person. I went to nursing school in England, right? And I would constantly, it seems to me now, on looking back, it's like at least once a month, I was calling my mother, telling her, I'm done with this, I'm coming home.
Yes, that's our quote. That's all of our quotes for sure. Absolutely.
It never quite materialized that way, because the hold on you is so strong.
It is.
The hold on you.
It is. I'm with you 100%. So you go through all that, you go through those blood, sweat, and tears, and you remember those crying episodes. You remember, I need a couple of more points. I got to do this on the exam. You remember crunching the numbers. You remember staying up late studying. And you went through all that to get to the point where now you're the nurse and you're going to allow a staffing issue to turn you away. You know, you're going to allow the manager who's having a bad year turn you away. Absolutely not. You fought too hard to get here. Why would you give up now? You know, and that's the conversation we need to have, because it's almost like out of sight, out of mind. No, remember those moments where you could have walked away. No one told you to stay in the game. No one told you to finish the process. You could have walked out before you became a nurse. So when you become a nurse, why would you let anything stop you when you could have gave up long ago, you know?
Yeah, absolutely. And sometimes we have to realize that. The problem, for example, you mentioned the manager or whoever it is that's having a bad year, but you have to not internalize the issue.
No.
It's their issue. It's their issue.
But you know, we're not taught that. And that's another thing, especially from, in my African American, I'm from the hood. Like, I'm really from the hood. And we're not taught how to handle crucial conversations. We're not taught. It's almost like we always have to be on the defense, of like defense. We're not okay with having self-control and saying, in this moment, this conversation is not healthy for me to have. We can evaluate this another time, but at this time, what can I do for my patients, or what do you need me to do? It's like, as soon as you hear something, well, who are you talking to? And that is, we have to learn how to get past that. And I'm gonna tell you, it comes with those conversations. And sometimes I love to do skits where they can see themselves in other people without being on the spot. And they're like, that's not me. And it's like, yes,
that is you.
This is you. And it gives them a mirror, and they're like, oh my goodness, I did not know this is how I was looking. And so you're giving them exactly what they want from you. They don't think you're educated. They don't think that you have self-control. They know that this is what their experience with our culture has been. Change that narrative for them. That's
something very important to bring up, because I do remember, you know, there was a time when I worked as an ADNS or DNS, and I would get complaints, and then, you know, you speak to the person, and they said, but that is not what I said. I said such and such. I said, but that's what they said you said. But what did your body say?
Right.
Your body language, I know,
Mm-hmm.
conveyed a totally different, you had a totally different connotation. And you have to make people see that sometimes,
Yeah.
what they say,
Mm-hmm.
it's not what they said.
Right. And it's so funny because I'm really getting into this entrepreneurship and I absolutely love it and I'm learning so much. And one of the things that they recommended is that you create an avatar, like a person that you can see. And so I use my middle name and then I use my before I became a nurse self, and one of my most avatarish team members that I can have is a young lady who was from the hood and she was as raw and as ghetto as it can be, but it was so beautiful because I nurtured her and I coached her and I nurtured her and I coached her. And what happened was when she was she knew her stuff. She was very talented as a nurse. Skill set was not, like above the rest. She was so awesome, but it was those soft skills. It was the people skills. It was the interaction. It was the teamwork that she needed help on, and she identified with that. And so we would talk. And so I would tell her, I would come up on a unit. I would get a call and say, this person is up here acting a ruckus on the unit, not listening to the charge nurses. And when I get up there, she will always already be at 10.
Mm-hmm.
And I told her, when you have an incident that takes place and it's something that's done inappropriately to you, that's one problem that we can solve. But when you step in and respond negatively to, now we have two problems. I can't just deal with this issue of how they treated you. Now I have to also coach you on how you treated them. If you know you're at that place and you feel that hair on the back of your neck standing up and you know you're about to blow off, I said, get really quiet and send me a text and say, I need you. And she started to do it. And when she got up, when I got on the unit, Miss Nichelle, my name is Nichelle, Miss Nichelle, I'm so upset because so. And we would have those med room conversations. The med room conversations, like, come in here real quick, come in. And so we would have those med room conversations. And I would say, okay, I understand that, but let's just focus on patient care. And I would coach her in that moment. And then now I'm getting calls and saying, we asked India to do something, or we asked her to say something, and now she's not responding at all. And so I said, well, did she argue? Did she, because that's growth for her. And she has that right not to say anything in that moment, because if she says something inappropriate, then she would be in trouble. But if she's being quiet, I can handle that. I can come up and talk to her. Well, I don't feel like you should have to talk up. Everyone is in a different place. So even though you don't feel like I should have to come up and speak for her, that's what she needs. And then once she's able to get to that place of speaking up for herself appropriately, we'll get there. And she ended up getting there. But it took time and nurturing. And I just, every time I see her face and I hear her voice, that's who I'm creating the nurse retreat for. That particular nurse who hasn't been taught those skills.
Yes. You brought that full circle. I love it. I love it. Dr. Nichelle, do you have any more words of wisdom for me?
I just want to say thank you so much. This has been a pleasure, and I'm always available when you need me. This is awesome.
Thank you so very much for talking to me today. I really appreciate it, and I enjoyed it. I have to tell you, I loved every minute. Thank you so very much.
Absolutely. Thank you.